Well, it's on my YouTube link now. I have to upload it.
You want that right there. This one's first, okay? So on this side so you can see. Everybody's going to see.
You mind if I get this angle here?
Go for it.
So we have an artery and two veins, a typical thing that we'd find, okay? Artery, the blood's going down. How can you tell that, besides that arrow? Because I have tape.
No valves.
No valves, so you can't tell. How can you tell then?
The lumen smaller. The lumen smaller.
But how can you tell it's going down, not up?
It has a arrow going down.
No, I have tape.
Right on, Nav.
I have a piece of tape.
in between the two.
Okay, and what do the veins do?
Go up.
They're going up, so you can tell the veins are going up, so the artery has to be going in the opposite direction. Okay, that's how you tell. Okay, so in the veins, you can see the wall is much thinner, the lumen's larger than the comparable artery. Much thicker tunica media here. Tunica interna, media, elastic lamina, internal and external, and then the adventitia on the outside. Okay, so these valves look more like semilunar valves, right? Mm-hmm. And you can see they're joined together, so that again indicates going back to the heart. Okay, let's move this one out of the way. So you should know the layers of the heart and everything there. Heavy though, that's no problem. This is the liver. Liver's made up of 4 lobes. But within the lobes are lobules, smaller parts. These are sort of basically 8-sided figures. This is a portal triad.
Triads.
A branch of the hepatic artery, a branch of the hepatic portal vein, and a bile duct. So coming in, we have blood from the artery, the branch of the artery and the branch of the vein, and they mix together in these liver sinusoids. So those are special kinds of capillaries where the blood mixes together. Deoxygenated but nutrient rich, oxygenated but nutrient poor bloods. They mix together, the liver gets first crack because it's a very metabolic organ. It makes bile and it stores some things. It makes your plasma proteins. So there's a lot of different things here. Okay? And this is a lung. So these are alveoli, the air sacs. Gives you lots of surface area, about the size of a handball court or something in surface area. And so you can see branch of the hepatic artery coming in. Pulmonary artery coming in. Branch of hepatic arteries going out. Veins coming out. Arteries coming in are blue. Veins going out are red. Let me say it again. One more time, okay? Branch of the hepatic
This is pulmonary?
Pulmonary artery coming in, carrying deoxygenated blood. Picks up oxygen. Leads through the pulmonary veins, which are now carrying oxygenated blood. Okay, and these are little capillaries here.
The veins going out, arteries coming.
Yeah, veins go to the heart, arteries go away. And here's our little baby. This is the placenta, umbilical cord. I know, it's just really
Junior.
Okay, it's not junior. It's just, so we have 2 hepatic, through umbilical arteries, branches off the internal iliac arteries going in, carrying deoxygenated, nutrient-poor blood. Picking up oxygen and nutrients would be the umbilical vein, leaving the placenta. The placenta is where you're picking up everything, okay? You're making a frown. Yeah. Your little wrinkle there. So here's that umbilical vein. It's going to bypass the liver, the ductus venosus, join up with the inferior vena cava. In the right atrium, most of the blood's going to go directly from the right atrium to the left atrium through the foraminal valley. Some of it sneaks into the right ventricle, goes out through the pulmonary trunk, then goes through the ductus arteriosus to the aorta. Okay. So the mother is doing a lot of the work. I mean, she's doing the breathing, she's doing the eating, the baby's not eating. The baby is peeing, however, in there. Isn't that nice to know?
But their blood doesn't mix, right?
Drip.
No. How does it do that?
How does it pee?
How does it not mix
Like
the blood?
well, there's these little things hanging down and
Filtration process.
but they don't exactly mix. There's some things that can cause the placenta, but the bloods don't mix. There's a barrier there. But like I say, the baby the liver's not very functional, the lungs are not functional at all, but it is making urine and peeing in there.
So coming off the placenta, the red one, this is veins, the red is veins, it has oxygen.
Because that's picking up oxygen. Okay.
It doesn't poop? Sometimes.
When it first comes out, it does. I don't know if it does. I don't think it does much.
When it comes out,
Yeah.
Oops, I mean.
Landing
got
right
a
away.
name to it.
Some
What is the name of it?
meconium.
Yeah. That's it.
Okay, so that's about it.